Hello everyone, my name is Hyson Lim and my case is about the 1993 Jack in the Box E. coli outbreak. So some background information regarding this case. It started in 1993 in the Jack in the Box located in Seattle, Washington. This location sourced their patties from the Vaughn's companies of California, which contain a strain of the O157H7 E. coli bacteria, which is harmful. The hamburgers containing the patties were cooked at 140 degrees, even though Washington state required that patties be cooked at 155 degrees, meaning they were deemed undercooked. Around 700 individuals in 4 states, Idaho, California, Nevada, and mainly in Washington, became ill. Since Americans of all ages and genders consume fast food, many demographics were affected. However, young children were most severely impacted, with the majority of the hospitalizations being children. Many suffered from hemolytic uremic syndrome. Furthermore, the 4 deaths that had resulted from this outbreak were all kids. Based on the affected population, there were various factors that needed to be considered as the solution was being designed. Firstly, ensuring those impacted, such as families and their children, receive proper compensation. Jack in the Box would have had to consider the cost of treatments, medical bills, and lawsuits for the individuals that were hospitalized. Secondly, they had to educate the population about foodborne illnesses and consider the culture surrounding the importance of food safety. Many Americans at the time were unaware of the dangers of eating undercooked meat and the potential consequences it could have on one's health. Lastly, regaining trust from the affected population. This case is particularly sensitive due to the fact that young kids were the ones most affected. Jack in the Box needed to find ways to rebuild consumer confidence. So, a SWOT analysis of this case. One strength presented was that Jack in the Box introduced a hazard analysis critical control points, a system used to identify potential hazards during food production. The Jack in the Box case actually led to the HACCP being mandated in the US, which greatly improved food safety. One weakness was that Jack in the Box did not act promptly and took little accountability. They attempted to completely shift the responsibility to suppliers, even if they did not follow state cooking requirements. At the same time, a threat they faced was that the meat they used was indeed sourced from outside suppliers, meaning Jack in the Box held little control or the ability to monitor. Lastly, an opportunity Jack in the Box had was that they could use this as a chance to rebrand their business, where they could place an emphasis on how they value food safety, enabling them to regain consumer trust. We know that the outbreak sparked due to undercooked meat containing the E. coli bacteria, but the root cause of this case was intensive agricultural practices. This includes factory farming and feedlots, where animals are packed closely together to ensure maximum yield in a space. Cattle will naturally produce great amounts of manure, which contain the E. coli bacteria. Since they are in such close proximity to one another and are compacted, the manure will get on the animals, allowing E. coli to spread. Corn, which is a common food used in feedlots, causes acid in the stomach, which create the optimal conditions for E. coli to live. The bacteria makes its way to the slaughterhouse, to a meatpacking plant, and eventually distributed to restaurants such as Jack in the Box. Alongside intensive agricultural practices, tracing the source of contamination was also part of the root cause. It was difficult to track livestock because it was uncommon for them to be tagged at that time. This contributed to the persistence of the outbreak. So, some alternatives to solving the problem include educating the public and implementing guidelines regarding safe food preparation methods. This is supported by the social ecological model, as food safety will be addressed at various levels of an environment. For example, at the individual level, a person will learn safe cooking habits and could teach this to their friends or family at the interpersonal level, while learning from them as well. At the community level, local health departments may reach out to restaurants and teach them proper food handling methods. At the organizational level, this could involve enforcing actual food handling policies within fast food chains. At the policy level, this could be the federal government creating food temperature standards, such as the safest temperature to cook meat at. Another alternative is to refine methods of traceability to better track food production at all stages, such as tagging livestock with RFID or EID tags, which identifies livestock that could be or are potentially infected. This solution is supported by the health belief model. For instance, perceived susceptibility demonstrates that individuals are aware the livestock can carry diseases which may spread. Perceived severity means that these individuals know that E. coli can severely impact one's health negatively, Therefore, they see the perceived benefits, where tagging can track sources of contamination, preventing an E. coli outbreak from spreading further. Perceived barriers could be the cost of the tagging system, but these barriers could be overcome if budgeting is allocated equally among farmers and the government. A cue to action would be a push from the USDA to improve traceability in order to effectively tackle outbreaks, encouraging farmers and industries to start tagging livestock. Finally, self-advocacy is developed as confidence will be gained among agricultural industries, as they believe that they can handle outbreaks easily since they can identify contamination and eliminate future threats. One recommendation I have is to use a management system such as HACCP that examines food safety and different hazards throughout the food production process. This would be effective as it allows for the early detection of hazards. If E. coli is found, then the source can be swiftly removed. For example, Jack in the Box could use HACCP by ensuring the meat being served to customers is not undercooked. If it is undercooked, they will not serve the food, as it may contain harmful bacteria. Another recommendation I have is to encourage industries to adopt pasture-raised farming, which gives more space for cattle to graze. This is an effective method as the risk of E. coli spreading decreases as the animals are not in a small space. To restate, both these recommendations address the causes, improper cooking methods, and factory farming. This is an action plan to implement a tagging system, which improves methods of traceability, preventing the prolongment of an outbreak. During months 1 through 4, you can work with the USDA to plan and advocate for a tagging system, such as adding RFID tags in livestock to easily track outbreaks. During months 5 through 6, you can discuss these details with farmers or leaders of agricultural industries. It is also important you create a budget and determine what percentage of costs are covered by farmers or the government. Furthermore, you must provide the proper training for these farmers regarding the new system. During months 5 through 9, you can perform a test run, where farmers will begin to tag livestock. USDA staff, data analysis, and additional workers in the agricultural sector will regulate the system. Lastly, during months 10 to 11, any necessary revisions can be made. Livestock will be tagged and continue to be regulated by the USDA, data analysis, farmers, and workers. This case can be compared to an incident in the United Kingdom. In 2005, South Wales experienced an E. coli outbreak. There were 157 cases, 31 hospitalizations, and 1 death. It was caused due to meals containing E. coli and were ultimately distributed through schools. Unlike Jack in the Box, however, the meat was cooked properly. The main cause was due to the supplier. The butcher who supplied the meat, John Tudor and Son, failed to comply with hygiene standards, such as not separating raw and cooked meats correctly. Ultimately, the solution of the case was to remove the meat as early as possible from the food chain. This was done by investigating the sources of contamination and finding links between the cases. In my opinion, I believe that the South Wales E. coli outbreak was handled much more effectively than the 1993 Jack in the Box outbreak. Their quick response and control prevented hospitalizations and death, whereas Jack in the Box failed to respond promptly as they initially denied accountability. Thank you for listening to my presentation, and these are my sources.